Hello ladies and welcome to my channel. My name is Aisha, aka Nurse Aisha. Welcome to our female to female conversations where I inform you about women's health, preventative health for women. Now, if you like this type of content, make sure that you subscribe, like, and comment. Do not forget to click the notification bell so that you are the first to know when I upload a video. All right, ladies, on this episode, we're going to talk about endometriosis. Now, March is the Endometriosis International Awareness Month. Now, this is a severe disease for many women. Now, we're going to dive into the symptoms, diagnosis, and treatment for endometriosis. Let's get started. So let's dive into it. What is endometriosis? Endometriosis is a female disease in our womb, and what happens is that the tissue similar to the lining of the womb grows in other areas where it shouldn't be. Now, this causes a lot of problems, and it could happen to a woman at any age. So this lining or this tissue can grow in the ovaries or the fallopian tubes and cause a lot of problems for us as women. All right, so the cause of endometriosis is not known, unfortunately, but it's very much linked to genetics, your DNA, as well as your immune system. But really, the actual cause is not known. All right, ladies, let's dive into the symptoms for endometriosis. Now, for some women, endometriosis might not even cause you any discomfort or any type of symptom. But for many women suffering from endometriosis, it comes with many symptoms. And the main symptom for endometriosis is pain. Overall pain all throughout your female cycle. Heavy periods, that's the beginning, that causes pain. Pain during your periods, pelvic pain, pain during intercourse, pain while urinating, constipation, diarrhea, and in worst cases, when you get to the age where you want to conceive, that could also be an issue. And then, the worst case, endometriosis could cause you infertility. Now, when it comes to endometriosis, the pain is the main issue. And ladies, we need to deal with this. We need to not normalize the pain, because that is my main concern when it comes to us as women, normalizing the pain, because usually we connect it to our periods and think that you should be in pain while having your periods. But that is not the case. We need to not normalize the pain, because that's the first symptom that you will get. So let's dive into the diagnosis of endometriosis. So as other diseases in the womb, endometriosis could be mistaken for other diseases such as fibroids, cysts, or you could only mistake it for just normal period pains. But what you need to do is seek help for abnormal pain. And you would know, or you can ask if it's normal to have the severe pain where you can barely get out of bed, when you can barely stand during your period. This is not normal, ladies. So you need to go to your general practitioner to begin with, and then you get a referral to your gynecologist. All right, so if you get the diagnosis with endometriosis, your gynecologist will go further with treatment method. All right, so the diagnosis method for endometriosis is usually an ultrasound. So if you've done an ultrasound and you're diagnosed with endometriosis, that will be further to the treatment. So getting diagnosed with endometriosis is very difficult because the symptoms are similar to other diseases, like we mentioned earlier. Now, the first thing to do is approach your general practitioner, and then you go further to the gynecologist, and they will go further with an ultrasound to make sure that that is the case. Now, if an ultrasound cannot detect if you have endometriosis, your gynecologist will suggest another method, which is usually an MRI. Now, when that is done and you're diagnosed with endometriosis, we'll move further to suggested treatment. Unfortunately, there is no cure for endometriosis. So what it's done instead is to relieve the symptoms. So symptom relief is usually what is recommended for many women, and that is usually instant pain relief. Now, what your gynecologist will suggest is either paracetamol or ibuprofen for the pain relief. Now, if that is not enough, there's a long-term relief for the symptoms that you might have. So many women will be recommended a contraceptive pill or some type of implant to relieve the symptoms. If the damage is severe in your womb, many women will be suggested surgery. And this would be surgery in the organs or the areas that have been affected by the endometriosis. And usually the womb is severely damaged and you would be suggested a hysterectomy. But this is not the main treatment you have. This is not the only treatment out there. You need to discuss this with your gynecologist. On this channel, we focus more on preventative health. Now, my experience with female disease is normalizing the discomfort, normalizing the heavy periods, normalizing the pain, because we're caregivers and we care more about others and do not acknowledge our own pain. Now, what I want you to take with you is do not normalize the pain. Do not normalize the constipation. Do not normalize the heavy period. Talk about it. Go to your gynecologist or your general practitioner and talk about it. Discuss it, maybe first with your friend if that feels more comfortable. We need to talk more about the pain. If you are not able to go to work because you're in severe pain, if you're not able to take care of your children because you're in severe pain, you're not able to go to school because you're in pain, and you're bleeding out, you're changing your pad 3 times an hour, that's not normal, ladies. Do not normalize the pain. This is what I want to take with you. So ladies, what we need to do is to put on our own mask first before we help others. Because as natural caregivers, we forget about ourselves. And this is not okay. Make sure that if there's any suspicion that you have an issue, a problem with endometriosis, talk about it, and always remember that you're not alone. You're never alone. If anything, I am with you. Thank you for watching, and come back for more female-to-female conversations. Until next time, do not forget to subscribe, like, and comment, and also click that notification bell so you're the first to know when I upload new videos.